View from the Bay starts now.
Take advantage of it. Coming up next, we're going to show you how to take care of your skin. How would you like to make your skin look years younger? We'll find out how with little help from your doctor. That's coming up next. If you'd like to make your skin look years younger, and who doesn't, and reduce the signs of aging, excuse me, our next guest is here to help. Welcome Dr. Michael Kulick. He's private practice plastic surgeon, that's easy to say for me, here in San Francisco, and Audrey is joining us in this segment as well. Good to have you here.
Nice to have you.
Well, before we get to the specific practice that you offer, procedure that you offer to make the skin look more youthful, just as a general rule, what can we do to protect our skin other than stay out of the sun?
Well, sunblock obviously is number one. I think that's the best. I think that not smoking would be another nice option. I think that using products that have vitamin C in them, perhaps alpha hydroxy acids, pentapeptides, these products that are over the counter, that there are millions of these products out there. Going to estheticians, getting a regular skin treatment.
Oh yeah.
So those are some relatively,
yeah,
exactly. Those are some relatively inexpensive options that people can do.
Well, you offer a special procedure called Photorejuvenation. Tell us what that is and how it works.
It's a process where you come in a doctor's office and you receive these treatments that require no anesthesia. There's no downtime. Essentially, you can go out that night with hardly any cover-up. And it simultaneously, this is the important part, simultaneously reduces red, brown, reduces pore size, improves texture, and even reduces wrinkles.
Well, now,
oh, no, I confess, I did this. You know, it was the first thing, after you use topicals, and they do work. I mean, creams are very good and everybody should use them. But there comes a point when you need a little bit of extra help. So this was the first thing that I tried in my late 40s. And it really worked. You know, they put a gel on you and it does not hurt. And the results were phenomenal. I had 6 treatments.
What results did you see? What was different?
Well, you know, age spots, freckles. I'm a freckly person because I'm really a redhead. So those all diminished. And I noticed this is a side product from it, but I actually felt and saw, you know, less wrinkles. So it was a tightening of the skin as well.
And this is a non-invasive procedure?
Non-invasive, in the office, no anesthesia required. It's pretty nice.
Well, we have some before and after photos I want to show our viewers so they can get a sense of just how this works. Now, describe here the change in this
This is a young woman that's in her late 30s that on the left-hand side, you can see all the red and the brown and the freckly. That's another set. That woman is in her 40s. And both of them had this treatment. The first person had about a 40% reduction in spots and wrinkles. And that, again, was over a series of 5 treatments, which is hard to do, and it's non-surgical.
And how long do the results last? I mean, do you have to go back again and again to do it over?
Well, if you stay out of the sun, take care of yourself, they tend to last forever unless the problems are genetic. So if some of those spots are from hormones, obviously, then those spots can come back. But if they're from sun damage, bye-bye.
Now, I had a friend of mine in L.A., and he's, you know, he's in the biz, so he's very vain, and he had a lot of redness and a lot of rosacea. And he tried this, and it worked phenomenally on him as well, so it was like the results were incredible. Now, when I had mine done, they did come back. So is there some kind of, you know, do you need to go back every so often and have like a new treatment or something?
What you're probably seeing is the genetic freckle expression versus true sun damage. So your sun damage went away and probably stayed away, versus the genetic component, which are the freckles that you were born with that tend to come back. And that's why these computer analysis programs show you, because you can look at that picture side by side. Right. And it's pretty hard to not see the change.
And getting back to what other things people can do to make their skin look more youthful, is diet an important factor? How about supplements, things like that?
I think that conceptually, those are all good. It's just hard to show any studies that have double-blind control studies where you take a certain food and you take a different food, but when you're a man, she's a woman, you know, different age. So it's so hard to do diet studies and supplement studies that just conceptually it's a great idea to do.
Now, can this work on any skin color?
Any skin color, any skin problem, any skin type, just the number of sessions will be different. So Spencer would have more sessions, darker skin type, would want to be more protective of his skin.
Right.
So you might have 5, he might have 8 to 10.
Right. I am having that freckling thing going on now just in the last few years, in my mid to late 50s, I started to develop this freckling. So this procedure could take care of something like that.
Right. And you're paying the price for something that you did as an adolescent. We know you behave now.
You want to
Back then, you
bet?
probably didn't.
I have to behave now. I was able to misbehave when I was younger. Well, Dr. Kulick, thank you so much. This is really fascinating, and there's more information on our website, by the way. So this is great, and you are living testimony to...
Well, you know, it worked for me. I must say, it worked for me.